Hi, Dr. Paller. Thank you so much for joining us on MD Newsline. We're really excited to get started on our conversation. Can you please introduce yourself to our audience?
Hi, I'm Amy Paller. I'm the chair of dermatology at Northwestern Feinberg School of Medicine. I'm a practicing pediatric dermatologist, and I've done a tremendous amount of work through clinical trials and work in my lab on psoriasis.
Excellent. Thank you for sharing that. So, can you tell me a little bit about the most important differences between pediatric psoriasis and adult psoriasis?
Pediatric psoriasis is most common in adolescents, but certainly can affect younger children. I would say the most important difference is how frequently pediatric psoriasis is missed by primary care providers and even sometimes by dermatologists because it can look different. Kids much more often have facial involvement, and it's not necessarily those well defined plaques that we think about with psoriasis. It can almost look a little more like atopic dermatitis, or it can be mistaken, for example, to be tinea or ringworm because it can appear annular. The scale tends to be less. And again, it's just often not thought about. Psoriasis is also not something that's taught a lot about in pediatric training, for example. So, very many of the patients that we see who come in who have psoriasis have not been previously diagnosed.
What are some strategies that you would recommend to doctors, especially primary care physicians, to increase the accuracy of diagnosis when it comes to psoriasis?
Well, I think they need to recognize that psoriasis is one of our more common inflammatory skin diseases in children and realize at least what classical looks like, but also the range of manifestations that psoriasis can have in children, including looking more like a cross between psoriasis and a dermatitis.
So, when it comes to age, how does age impact the development or the appearance of psoriasis? Would you say that maybe it's laying dormant because of hereditary factors?
I don't know that we'd say it lays dormant, but clearly we think of psoriasis as a disorder where there may be a hereditary predisposition, and that's certainly true in children, in which there is a 30 to 35% chance that they have a first degree relative affected by psoriasis. But then it obviously takes some kind of an environmental trigger. That could be a microorganism, it could be something else, and certainly trauma plays a role when we think about capnorization. We don't fully understand this, but we most commonly will see the onset during adolescence, but we see kids even in infancy who have psoriasis. And we don't think about it very much because it's often misdiagnosed. Uh, I would say that 80 to 90% of children have some scalp involvement. Now, that's far more than what we see in adults, but is often mistaken for tinea infection or seborrheic dermatitis, especially as we get into adolescence.